welcome to the next webinar in our series on building the supply of high-quality childcare in high-need areas. We really appreciate your joining us today to talk about innovative state and local finance strategies. I'm Debbie Mathias with the BUILD Initiative. Before we get started, I wanted to go over a few housekeeping details. Due to the number of people who are registered and in order to include as many as possible, we set it up so that everyone is in listen-only mode. We hope it won't limit the interactive nature of this webinar. You'll all have the ability to write in the chat box, give us your questions and your comments and ideas. We want to hear from you as part of this discussion. You're all experts as well in terms of what's worked and not worked for you, so please do share your own experience as well via the chat box. On our last webinar, we had a great dialogue, not only between the participants and the speakers, but also among the participants themselves. So let's keep that going today. Now I'd like to turn it over to Zelda Boyd, Senior Technical Assistance Specialist with the National Center on Early Childhood Quality Assistance. Zelda, do you want to introduce yourself and say a few words about the work of the Quality Assurance Center and how to use this webinar series and thinking about your planning for the CCDF plan that will be due later this summer?
Thank you, Deb. I sure will. So good afternoon, everyone. As Debbie said, I'm Zelda Boyd, and I'm with the National Center on Early Childhood Quality Assurance. And I just want to take a few minutes before we get started with the webinar to share with you our focus here at the Quality Center and invite you to reach out to us when you have technical assistance needs. So we're jointly funded by the Office of Child Care, the Office of Head Start and Maternal and Child Health. So our priorities are to advance strong health, safety, and quality standards and licensing regulations. And as you all know, this is very important, a very important priority in the federal regulations. We also support the development and enhancement of state quality initiatives, and this includes the continued growth and refinement of quality rating and improvement systems. And then finally, our work includes enhancing quality assurance systems with things like technology, data analysis, and research. And these things make it possible for leaders and policymakers to successfully engage in continuous quality improvement. So if you're interested in any of the various resources that we have available that can help you in these particular areas, or if you're interested in TA and need some support, in the areas that I've mentioned, please contact us, and our information is available on the last slide in this presentation. So now I'm going to turn it back to Debbie so that she can introduce our speakers for today and to get us started with this webinar.
As you'll see, this is the third in the series, with today's webinar focusing on state and local finance strategies. There are 2 more webinars to come in the series, focusing on rate strategies and facility financing models. As part of the webinar series, we've created a web page with a recording for each of these webinars, any resource materials that are shared, and the PowerPoints. You can also go here to sign up for future webinars. Check this page out when you get a chance and share it with others that you think might be interested in the series. This webinar is focused on state and local revenue generation strategies that fund quality services for children and other aspects of a quality system infrastructure. The strategies include blending and braiding approaches to funding, the San Francisco financing approach, Dayton's income tax strategy, the Louisiana school readiness tax credits, and Philadelphia's soda tax, and Nebraska's Public-Private Early Learning Fund. I'm so psyched to be partnering with Ann Mitchell and the rest of our speakers, and I'm really excited now to turn it over to Ann Mitchell, who will lead us forward through this conversation today. Hi, Ann.
Hi, Debbie. Thanks so much. While you were looking at these lovely photographs of the panelists today, I'm going to introduce them in the order in which they're going to present. So I'm very excited to be moderating this webinar because I think that it is really clear that our current financial resources need to be increased. And we're going to focus today on ways that states and localities have successfully generated revenue, some of which has lasted for a very long time. And so I want to introduce our panelists in the order in which they're going to present, which is we're going to start with the most long-lasting revenue generation methods, and those are in San Francisco. So September Jarrett will start. She's the Executive Director, San Francisco's Office of Early Care and Education. Previously, she worked for the Office of the Mayor and as Director of Policy and Planning for the Department of Children, Youth, and Their Families. September was the Program Director at the Mimi and Peter Haas Fund, which is a foundation that works to ensure high-quality early education for San Francisco's low-income children and families. She was also the founding staff of the Childcare Facilities Fund of the Low-Income Investment Fund in San Francisco, and she has a Master's in Public Policy from the New School for Social Research and a Bachelor's in Urban Studies from San Francisco State. Next, we're going to hear from two presenters from Nebraska. Amy Bornmeyers, the Vice President for Early Childhood Programs at the Nebraska Children and Families Foundation. She is the administrator of Sixpence. The Sixpence Early Learning Fund has a board of trustees and administers the grants to the now 34 communities that offer programs for at-risk infants and toddlers in partnership with school districts and other local entities. Amy also leads the Foundation's Communities for Kids project, which supports communities in Nebraska developing sustainable plans for increasing the availability and quality of early care and education programs. Previously, she worked for the Nebraska Department of Education Office of Early Childhood. Amy has a Bachelor's in Human Resources and Family Science with an emphasis in child development, and she's working on her Master's in Management and Leadership. And she's going to be joined by Michael Medwick, who's the Senior Communications Associate for First Five Nebraska, which is a public policy organization focused on promoting high-quality early care and learning opportunities for young children at risk through legislation and public engagement. Michael was involved in the strategic communications campaign for the creation of the Sixpence Early Learning Fund. In his current role, he continues to message on behalf of Sixpence to state legislators and other key audiences, and he also provides communication support to a statewide association of Nebraska business leaders interested in early childhood investment as an economic development strategy. Next, we're going to hear from Donna Cooper from Philadelphia. Donna is the Executive Director of Public Citizens for Children and Youth, known fondly as PCCY. It is the Greater Philadelphia region's leading child advocacy organization and works to influence elected officials by combining research, solution-oriented policy recommendations, and the mobilization of citizens who advance the organization's work. Prior to PCCY, Cooper was a senior fellow at the Center for American Progress, where she led the center's research on early childhood education, public infrastructure, and contributed to the center's work on reducing the incidence of poverty. Before that, Cooper was the Secretary of Policy and Planning for the Commonwealth of Pennsylvania for 7 years, where she was responsible for education, public supports, environmental and healthcare policy, and the development of the state's Cover All Kids program, which expanded coverage, affordable healthcare coverage to nearly every child in Pennsylvania. She was instrumental in launching Pennsylvania's approach to investment in early childhood and previously served as the City of Philadelphia's Deputy Mayor of Policy and Planning. Cooper has degrees in government administration from the University of Pennsylvania and intercultural management from the School for International Training. And last, but certainly not least, but one of our newest initiatives, we're going to hear from Robin Lightcap about Dayton's work. Robin's led the early childhood collaborative work in Montgomery County, Dayton, Ohio, for the past 9 years, and she's the executive director of the Preschool Promise initiative. Robin also serves on the Governor's Early Childhood Advisory Council, and she is vice chair of Groundwork, Ohio's early childhood advocacy organization. Robin has led complex projects in both the nonprofit and the for-profit sectors, including at IBM, Chicago's Willow Creek Community Church, and Evenflow. She has a business degree from Wake Forest University. So let us move to September Jarrett to tell us about what's going on in San Francisco.
Thank you, Ann. Greetings. As Ann said, I'm September Jarrett, and I'm honored to steward San Francisco's Early Care and Education System as Director of our Office of Early Care and Education that was started a few years ago. I'm pleased to share briefly our San Francisco story. It's a story that's really built on decades of investment in early childhood, and our new initiative, based on 2 years of planning and research, was launched in July 2017, and it's called Early Learning Scholarship. It's really, I think, as Ann and Debbie both introduced, it is a braided and blended or stacked strategy. We're moving in San Francisco from what had been a very program-based approach where we had a network of either family child care homes or centers participating in city-based programs for preschool, for infant toddler care, or for compensation. And we've moved those multiple programs into a child and family focused approach. The heart of Early Learning Scholarship is paying the same standard, fairer, and predictable reimbursement rate by age and setting tied to our California QRIS. In California, we have a 5-star system, and our rates are based on the cost of quality or closing the gap to quality to Tier 3. We really seek to leverage every state and federal dollar available to serve children and families whenever possible. This means we use our local dollars, I'll tell you more about in a minute, to top off federal or state reimbursement rates to reflect that cost of quality based on a comprehensive fiscal analysis that was done for us locally that really helped us operationalize a fair rate. And in addition, because there's not enough state and federal resources to meet the needs of our low-income and our working families, we also use local dollars to fully fund access to high-quality early learning in family child care homes and centers. With Early Learning Scholarship, we're also trying to disrupt patterns of inequity, and we're really prioritizing enrollments to those children and families who have the most to benefit from participating in high-quality early learning. For us, based on the data in San Francisco, that means children experiencing homelessness, children and families involved in our child welfare system, children with special needs, as well as low-income early learners from populations that don't consistently demonstrate K-readiness. For us, that's our African American early learners, our Latino early learners, and our dual language learners. With this shift, it's pretty big. We're actually applying our QRIS learning standards to all licensed settings in which early learners are enrolled with city support, not just the ones that happen to be funded by our California Department of Education, but we're applying learning standards to all of our settings, especially those that are supported with voucher subsidies. I think most importantly, and the thing we're most excited about building a proof point over the coming years, is that we're funding continuity of care from 0 to 5. With Early Learning Scholarship, if state or federal eligibilities change, if a child is enrolled in a high-quality setting, we will cycle that child's participation in a quality program to local dollars so that there's a seamless participation in high-quality early learning for multiple years before K entry. We think that combination is a successful result. This is based on years of leadership and investment in San Francisco. I like to think of our story as a multi-chapter book. Chapter 1 goes back to 1991 when San Francisco was the first city in the country to establish a children's fund. Back in the beginning, 1/3 of a cent of every property tax dollar was dedicated to a local children's fund focused on strength-based preventative services for children and families ages 0 to 18. Chapter 2, and it's a really important chapter for us in San Francisco, is really about our workforce supports for the early care and education community. In 2001, aside from our Children's Fund, our government invested local general fund dollars into paying teachers a little more for their work with our youngest children, both through stipends that recognize years of service as well as wage augmentation, and that work was refreshed in 2012. The third chapter of San Francisco's investment and story is one of universal preschool. I'm proud to say I was able to vote for in 2004 our Public Education Enrichment Fund, which did 3 important things, one of which is creating a dedicated funding stream for access to universal, high-quality preschool for all of our city's 4-year-olds. This program continues to today. Chapter 4 is an important chapter. I think it's the chapter of the story we're writing now. In 2014, all of our children and youth initiatives came together in one Mayor and Board of Supervisors-led initiative called the Children and Families First Initiative, Prop C 2014. In this initiative, we extended and increased the property tax set aside for children and youth services from ages 0 to 24, so transitional age youth, created a funding stream for a 25-year period, and created an Our Children, Our Families Council that's kind of a collective impact framework which established common outcomes for our children and youth 0 to 24. ECE and early childhood is our common foundation. What we're reaching. San Francisco's model is we believe in building a continuum, applying learning standards and increasing compensation for all of our workforce working with our youngest San Franciscans 0 to 5. We're building a system where we want to provide financial assistance to all low-income families at their to access high quality at that critical window when brain development is its greatest. We're reaching about 1,900 infants and toddlers with the Early Learning Scholarship Strategy today. In addition, we couple that with our vision for free and universal preschool, which today offers every San Francisco 4-year-old a free half-day option. And we're building to full-time, full-year free options for all our low-income San Francisco preschoolers. We're reaching more than 5,500 children today. This slide gives you a quick picture. I realize this level of investment is a gift, and we work really hard to make the most of every dollar and the time in the early childhood system. This gives you a sense of some of the braiding and blending that's under the Early Learning Scholarship brand. Sometimes we're enhancing a reimbursement rate from a state or federal source to cover the cost of quality or pay a fairer wage to the professionals doing the work. And sometimes we're creating access for populations for whom state and federal subsidies won't fit or won't create access for the family. This about $64 million in local funding is coupled with about $100 million of state and federal grants that are outside our direct budget, but for whom we're sort of aligning resources and services. There's a 5th chapter in San Francisco, and it's being written as I talk today. Despite the amazing history and longevity investment, we're still only meeting about 25% of need for infant and toddler, and we still have a bit of a ways to go in preschool. And our wages are far below a living wage in San Francisco. So our communities rallied and qualified by signature is a June 2018 ballot measure. It proposes creating a commercial gross receipts tax on large businesses. It would be permanent if it passed, and it's estimated to generate about $110 million more dollars in local revenues to devote to our early education system. The priorities in the measure call for clearing the wait list, so we're serving all state and federal eligible subsidy kids, and begin to provide infant toddler assistance for working families, families that are above state and federal eligibility but still can't afford the cost of quality in our high cost area. The revenue measure would also allow resources for us to increase our reimbursement rates to pay higher wages for the diverse workforce and support comprehensive services. With that, I'll pass it on to the next speaker.
Hi, this is Amy Bornemeyer from Sixpence in Nebraska. Sixpence is an innovative collaboration between our state's public and private sectors. Sixpence provides funding and enhances the quality and efficiency of early learning and development services offered in communities throughout Nebraska. Sixpence demonstrates how targeted investments in the school readiness of our youngest, most vulnerable children are also investments that strengthen our families, communities, and states. Each 6 cents funded program represents a community partnership between local school districts, service providers, and other area agencies and stakeholders. This community-oriented focus enables each 6 cents program to be highly responsive to the unique needs of the children and families it serves and leverage local resources more efficiently. You can see from the 3 options that center-based, home visiting, and child care partnerships are 3 of the grant models that are funded through 6 cents.
Okay, so I'm going to pick up a little bit here and talk about sort of the provenance of 6 cents and how we got to where we are through legislation. So this story, we're going back now to the early 2000s, and one of the things that sort of obtains in Nebraska is that public dollars are traditionally earmarked for early education, are traditionally prioritize preschool programs for 3- and 4-year-olds. But what we came to realize that we're missing about half of the youngest children at risk in Nebraska are infants and toddlers. So around this time, we're talking the early 2000s. We're getting a lot more research about the developmental importance of the first 3 years, research on the returns on strategic investments in early childhood education, and policymakers are getting a lot more interested in what could be done to reach that 0 to 3 age population, with the understanding that public dollars alone can't do it. So what happened here was the discussion started about how to create a public-private structure that would provide sustainable funding for high-quality infant and toddler programming and deliver accountability for the dollars committed. So what happened was the private sector came forward and came to the table with $20 million, a commitment to provide $20 million within 5 years of the passage of legislation that would create a public-private endowment specifically focused on infant and toddler programming. And that $20 million was used to trigger a $40 million commitment match from 2-to-1 match from public sources. And what would happen is these 2 pots of money would be invested separately, and then the earnings deposited into a common cash fund to provide grants for high-quality early learning programs focused on infants and toddlers. And that's what happened. We ended up passing the legislation in 2006, but we had to identify where that $40 million was going to come from. And that required a ballot initiative to create a constitutional amendment that would make Nebraska's early or educational land and funds dollars take a portion of that, $40 million portion of that, and use the investments from that to provide the public side of the corpus for the endowment. So fast forward to 2013. We are, 6 cents is performing the way we want it to, the way we expect it to. It's living up to the vision we had for it. It's improving the developmental outcomes of infants and toddlers. It's standing up to that rigorous annual evaluation, independent evaluation process we set up for it. And it's allowing us to monitor the progress of the dollars from the source to program delivery. But the problem is we're still only reaching a relatively small fraction of infants and toddlers at risk in Nebraska. So in 2013, we came to the legislature and said, we would like to explore ideas for creating additional infusions of public dollars directly into the 6 cents cash fund to complement the investment earnings that are being generated by the corpus. And we succeeded. We were able to secure a sort of this actually, the way it looks on the slide is a little misleading. That $11 million infusion to the cash fund over 3 years. Well, but there's an ongoing general fund appropriation that has continued since then. It's about $10 million, I believe. And that renews every budget cycle, and it's our job to protect those dollars so that they continue to be renewed. And then in 2015, Amy, do you want to pick up the story here with the creation of the Childcare Partnership?
Yes. So in 2015, through the reauthorization of CCDBG, our dollars were earmarked for the purpose of improving quality child care for infants and toddlers. And it was proposed that those earmarked dollars be split between our state's quality rating and improvement system and the 6-cent model of funding to allow for these funds to be used for a child care partnership model. And that is where the investments go to local communities who partner with their local child care providers to enhance the quality of care specific to infants and toddlers. And that is recognized through our state's QRIS system with a requirement that at the end of the 3-year grant term that each of the child care providers are at a step 3 of our 5-step QRIS rating system. And so observations are provided, coaching is provided, funds to purchase materials, supplies, equipment needed, and professional development needed to increase the rating and thereby the quality of the child care that is being provided locally. As you know, this is a fairly new model for us, but already the evaluation that we've that is a big component of our 6-cent model indicates that this is a good investment, that we're touching the quality of the experiences of many more infants and toddlers through this model than we could by direct funding our center model and home visiting models. But we continue to fund all 3 types to give local communities the flexibility to choose whichever model works best for them. And this is the first time that federal funding is used to infuse with our state and private funding. And so that brings us to the flowchart that Mike's going to talk a bit more about.
Well, yeah, just really quickly, this is an overview of what Amy and I have been describing. Moving from left to right, it's where the investment earnings come from, where those additional public investments come from, 2 pieces of legislation in 2013 and 2015, and how they're deposited into that early childhood endowment cash fund, which is then used to deliver and administer grants. And Amy, do you want to just touch briefly on the right-hand side of that diagram?
Absolutely. So one of the components that has been really key to the success of the 6-cent grants is the technical assistance that is provided to both the Board of Trustees, who make all of the decisions around grantees and how the funds are being expended, but then also the technical assistance then connects the board with the actual grantees and the partners that the grantees, who in this case are the local school districts. So it helps with partnership. The technical assistance is really helpful to make sure that all of the grant requirements are being met. And then the evaluation piece provided by an independent evaluator has been the sort of the key to success to have that additional funding being infused when we can show data that suggests that this is a good investment and that we are changing the trajectory of our most at-risk infants and toddlers, then we've been successful with getting that additional funding. But the flowchart does indicate that there is an integral relationship between the Department of Education, also through the Department of Health and Human Services, both of whom are trustees on the governor-appointed board. And then we also have representation from the private investment sector, as well as both rural and urban representation. And it was really important to the board that we have 6-cent grants going across the state in both urban and rural settings. And so this is how we have been successful in reaching out. We have grown from 13 grant awards to 11 communities when we first started, at $1.5 million to what we're currently able to support, which is we stopped counting individual grants because it became too confusing, because some communities have all 3 grant types, and some communities only have 1. But we have 34 communities across the state that have at least one of our grant models, and now we are able to support $7.8 million going out, and with those Childcare Partnerships, we're now able to serve a little over 1,600 kids, or infants and toddlers, all of which qualify for at least one risk factor that are predetermined. So that is our growth and how we have grown from 11 to 34 grantees since 2008.
Okay, and our final slide here is just a real quick view of something that we share with legislators that's been particularly helpful in us advancing legislation in support of sixpence. This is a heat map that First 5 Nebraska produces every year that maps out the relative distribution of children, young children at risk throughout the state based on county population, and we're actually mapping census data here, capturing children who belong to households at 185% of the federal poverty level or lower. And then those little birds there are the locations of the sixpence programs. And as Amy said, it's particularly important that we demonstrate that the sixpence has statewide reach, that it addresses children's developmental issues that are not specific to metropolitan or any inner city populations. We only have Omaha and Lincoln that would really fall into that category, but we're really addressing the developmental needs of children and families in rural locations wherever those families happen to be. So I think that about wraps it up for us. Amy, is there anything you want to say about the slide?
Oh, I'm good, thank you.
All righty.
Good. This is Ann. I think I'm going to break in here because we have some very specific questions about Nebraska. We also have a very specific question about San Francisco, but since we're in Nebraska, one of the questions is, how did Nebraska get the private sector to commit money? What strategies did you use?
A variety, a variety of strategies. We were tremendously lucky to have major philanthropy already interested in this issue, and that was specifically Susie Buffett and the Buffett Early Childhood Fund. And when you have a major philanthropist of that stature involved and invested in this, you're able to pull philanthropic interest behind it. So that's where a lot of that private sector input came from.
Great, thanks. We're going to talk more about that because that also applies in San Francisco and some other places where philanthropy is a leader in the community. The other question that's specific to Nebraska is, why is the Education Department a fiscal agency for communities? Can't the Sixpence Board just award grants directly to community-based organizations?
So the
Amy, do you want to take that one?
And yeah, the Sixpence Board does grant awards directly to the communities, but the way that the legislation was created, it is in statute that the awards be given to the local school district. But they have to be in partnership with local community providers. When Early Head Start is in the community, then they are required to be a partner in whatever manner is appropriate and agreeable to the entities at the community level. But certainly there are other partners that are coming to the table, and it builds on the gaps and availability of each community and each district's ability to either operate or subcontract out some services and partner with their local entities in whichever way that it works for their community. But then the Department of Education is the fiscal agent to then process all of those actual reimbursement claims because of the requirement that the grantee is the local school district. So they just follow the same process of reimbursement and grant management as they do for their other preschool programs and other like Title I programs.
And I think that's in part because the source of the sixpence money is an education trust fund.
Right.
Yeah.
I mean, that was part of the structure.
Yep.
One quick question. Are home-based programs working with legally exempt and informal providers as well as family child care providers? Is that what home-based means?
So are you talking about, when you say home-based, I think we are thinking home visiting. Are you thinking family child care homes?
Yes.
So we are able
to, part of it?
Yeah, we are able to work with child care providers who are licensed because they have to be licensed in order to be in Step Up to Quality, which is our state's quality rating and improvement system. But we do work with both centers and family child care home providers.
Great, thanks. All right, I've got one specific question for September about San Francisco. What impact has the free UPK for all children had on the child care centers in San Francisco? Are the centers financially struggling from a loss of income due to a loss of preschool-age children? I think I know the answer, but I want September to tell us really what's the answer.
Hi, thanks, Ann, and participants for the question. Real quick, I should have made it clear. Our universal preschool program is a mixed delivery system, and we have a network of 321 different family child care homes and child care centers delivering our universal preschool. And so of our 5,500 enrollments, about 2,000 are in our school district, and they are a preferred provider of choice among many families, but 3,500 or the vast majority are in our community-based partners. So there definitely is some impact with the district as a provider, but we've worked really hard to have a mixed, strong delivery system with quality options in all settings.
Great, thank you so much. All right, let's move on to our next oldest or next youngest program, Philadelphia. So take it away, Donna Cooper.
Hi, thank you. Do I advance the slides? Let's see. Okay, so why this slide says our kids are worth it is because in order for Philadelphia to replicate the early successes that happened in San Francisco in terms of local money being used to support the expansion of pre-K, we had to mount a campaign for a dedicated revenue source here. And like the other states and cities on this call, this has been a long-term strategy that's been underway for several years. But what we're going to talk about right now is the fact that Philly last year passed a tax on sweetened beverages to fund pre-K. It also funded rebuilding of the city's recreation centers and the libraries. So it was a joint effort of the communities that are engaged in our community recreation centers and libraries and the pre-K coalition, and that was pretty important. The very small writing on the next slide takes you through 2013 to 2017, and as you've heard in the other communities, this work takes many years to build the consensus necessary for substantial public investment. So in 2013, Pennsylvania created, not the state, the advocates created a statewide campaign for pre-K, and in doing so made pre-K the #1 issue for the gubernatorial race that happened in 2014. And even though what we're talking about now is Philly's sweetened beverage tax, it was the conversation that was started in that gubernatorial race that really put pre-K on the top of the agenda for elected officials, both Republican and Democrat, because of a really smart statewide campaign run to do that. And since the governor was elected, in that case it was a Democrat in 2014, to now $100 million been invested on top of the state's $150 million for, or $96 million for pre-K. And we'll talk about what that means, but the shorthand of that is the availability of school day, school year, pre-K connected to our state's QRIS system. In the top 2 rankings, we have a four-step QRIS for children who are ages 3 and 4. However, the state money we knew would take too long to get to universality. So those of us in Philly in 2015 put a ballot measure on our local ballot that said, do you think the government should invest in pre-K? We don't have referenda here. So it's really a sentiment of the voters. And 80% of the voters voted yes. It got more votes than 4 of the 5 candidates running for mayor in that primary. In fact, the person who won the primary beat pre-K by only a few thousand votes. So pre-K became the #1 issue in the mayor's race. And the winning candidate spoke about pre-K and what he would do about pre-K as his main platform for the reason he should be elected in the general election. And so his first budget address after being elected, and that's Mayor Jim Kenney, was proposing a sweetened beverage tax to fund pre-K. And then as part of the consensus building effort, created with our city council a commission to look at what does it mean to do high-quality pre-K, what do we in Philly mean for high-quality pre-K, and how much could we really make that possible with the soda tax. And I have a hyperlink there because I think that report is a really useful framework for the municipal conversations that really build consensus around ensuring that our city system and our state system were piggybacking so we don't have 2 monitoring systems, that we're connecting with the child care reimbursement system so we have access in the same place for wraparound care, and that we're using the city money to augment the state dollars for pre-K. And so as of January last year, after the tax passed in June, we had mid-year enrollment starting with 2,000 slots, and those slots are filled today. You'll see a little bit of stuff about what our ballot measure looked like and some of the data I just told you about how strongly the ballot measure won. That's been very important in sustaining and beating the big soda companies. We had to go up against Coca-Cola and Pepsi. They were very, very aggressive opponents, and we had to take a number of political strategies to win over the public that weren't always just about pre-K. They were about how pre-K expands jobs, how drinking sweetened beverages or unsweetened beverages is better for folks, how the soda industry indicated that this would be a tax on all groceries. So they were a very aggressive opponent. They spent about $15 million to try and stop the soda tax, and we had a $50,000 grant to beat them back. That just was an interesting parallel there. What we ended up with in Philadelphia is 1.5 cents per ounce. So if you drink a 12-ounce can of soda, you're basically spending 18 cents more in tax. This is a big issue for Americans who buy liter-based soda because it really increases the price of a liter. We had to spend a lot of time defining what a sweetened beverage because it doesn't just apply to soda. So chocolate milk and almond milk and anything that's sweetened, Coke syrups that go to bars because they were taxed everywhere. And then the tax is applied at the distributor. So those of you who know tax policy know a lot easier to collect it from the distributor of wherever the sweetened beverage is coming from rather than all the neighborhood corner stores, although I should say most of the neighborhood corner stores and groceries were against us. We did win the soda tax, and that was projected to bring in $89 million a year. Today, the city reduced its revenue estimate because people are going over the border to buy soda, and some people are not drinking soda anymore. So our annual expected take from the sweetened beverage tax is $78 million, of which $65 million is pledged for pre-K. When we roll out the full scale of this, it will be enough local funding for 6,500 pre-K, high-quality pre-K slots on top of the state slots down here. But it also includes several $1 million spent on worker training to bring people up to associates and bachelors so that centers can rise up through our quality rating system, and also for technical assistance for providers, the center directors themselves, and some facility resources. So right now, as I mentioned, the program is open to children, any child 3 to 5 years old. There's no income eligibility requirements. Big debate here on universality, but City Council came down on the side that anybody should have access. However, I will tell you, if you look at the third bullet, our providers were selected based on quality, stability, and location. So we looked for high-quality providers who have stable situations, aren't small and growing or going broke or have tax problems, but they're in the census tracts of the city that have the highest poverty and the lowest access to high-quality pre-K, either as a result of Head Start access or as a result of state pre-K. So when the city did its RFP, we recruited, PCCY, recruited the providers that were in the target census tracts. We're paying a standard $8,500 rate for a school year, and providers are getting a contract that basically specifies the maximum number of slots they'll be paid for, and then it's adjusted throughout the year, reconciled to whatever their enrollment looks like. What we know now is that 80% of the people coming into the pre-K program funded by the city are people who are at 200% of the federal poverty level or below, and 60% are at 100% of the federal poverty level or below. So the census level outreach really enabled us to locate programs where people have the biggest needs. We are still fighting the soda tax. We've only been able to roll out the first 2,000 seats. We are being challenged in court. So part of beating back the soda barrage against the tax, the mayor has been weekly visiting pre-K programs and pretty much is regularly talking about the impact that he sees in children, whether he's at a Chamber of Commerce event or he's at a church event or before our city council. The first story will be the impact of what he's seeing on pre-K, which is essential to making sure our council doesn't rescind this tax because of the public pressure. And then the last slide is just showing you the overlay between our city and our state funds. And what the blue bar is at the bottom is the, actually I can't even see the writing on this. I think the blue bar is our Head Start money. Is that right? Somebody who can see this? Oh, people can't hear. Anyhow, the orange bar is the rising state investment that the Pre-K for PA campaign is advancing. And the light blue bar are the soda tax-funded slots. So we envision that between what we're getting from federal funds, growing state funds, which we're doing annually, and the rising soda tax money, that by 2021 we should be able to offer nearly every child in Philadelphia high-quality pre-K experience. And when I say nearly, we define that at about 86% of all the kids in the city. We're making an assumption that some families are going to choose not to engage. So that's the Philly soda tax story.
Wow, that was great. I think there are going to be a number of cross-jurisdiction questions and observations that are going to come up after we hear from our last presenter. If there are any specific questions about Philly, you can hold on to them because we're moving into hearing from Dayton, Ohio. So, Robin, are you ready?
I'm ready. I am Robin Lightcap, and I'm in Dayton, Ohio, and our initiative is focused county-wide, although right now we are only in a couple cities within our county. And I'm going to talk specifically today about Preschool Promise, which is focused, as the name would suggest, on preschool. And obviously it's all about helping our kids get the foundation they need to be successful. Our particular promise is that we want children to be able to access at least 1 year of affordable, high-quality preschool. And so we are focused just right now on 4-year-olds. Would love to do 3-year-olds eventually, and obviously 0 to 5, but right now with our funding we are focused on 4-year-olds. And the way we designed our Preschool Promise, we have 3 different pillars. The first one is about educating the community about the power of preschool, and this really has to do with the marketing and making sure families understand why it's important to send their children to preschool and how they can benefit from it. And then the second pillar is all about quality. How do we improve quality, especially when we think about our child care programs that have historically, as we all know, been so underfunded. And with all of the new expectations around having degree teachers and implementing curriculum and doing assessments, we need to make sure that we really are shoring up that cost differential and helping them work on quality. And then the third one is assisting families, and this is where the tuition assistance comes into play. But I always like to talk about these three pillars because a lot of times when people think about these types of programs, they think just about the tuition assistance piece of it. And really for us, when we look at our budget, actually the biggest part of our budget is that quality pillar in the middle. And we also think it's very important to focus on marketing because it's not one of those things where if you just build it, they will come, but you actually have to really be going out and working in the communities to make sure they know what their options are and why preschool is important. So this is how Preschool Promise works. All 4-year-olds are eligible the year before kindergarten. Like I just talked about, the quality improvement is the central focus. We do align with our state's quality rating and improvement system. We have a 5-star system in Ohio. And with Preschool Promise, our goal is that all of our programs need to reach at least that 3-star level. And we do provide coaching to all programs. We work with even the unrated programs to help them get into the star rating system. But we only offer tuition assistance to programs that are star rated. So they're hopefully more motivated to get to that star rating level. The way our tuition assistance works, similar to the other initiatives, it is tiered based on income and household size and the star rating level of the program. And families can choose what works for them as far as a public preschool setting or a family child care setting or a child care setting. And they also can select if they need full day year-round or just a part-day preschool program. The next slide is about where the Preschool Promise is. Like I mentioned, our long-term vision is to go county-wide. We have 6,500 4-year-olds across Montgomery County, just to give you a feel for the size of our community. And we did start this effort with a very small pilot in one of our suburbs of Dayton called Kettering. And then as we figured out our model and went to the 3 pillars, we expanded and did a demonstration in the 2016-17 school year with a part of Northwest Dayton. And now this year, this current school year, we are continuing in that suburb where we first started the pilot, and we are across the entire city of Dayton. And we have about 2,700 eligible 4-year-olds in those 2 jurisdictions, just to give you a feel, again, for the size. And the way that we got to this place on the funding question, we started in 2014-15 with a small pilot, like I mentioned, that was funded by Montgomery County, our governmental funding that really went into this, along with the school district in Kettering and the city of Kettering. So it was a great example of a multi-public sector funding source coming together. We then, when we expanded to that demonstration year where I mentioned that we went to the 3 pillars of the Preschool Promise, we brought in private funders at that point in time. And we had a mix of businesses that have foundations, our Dayton Foundation, the Community Foundation, and then also continued to get funding from the local cities and school districts in Montgomery County. Then the big thing that happened in November of 2016, our Mayor Whaley in the city of Dayton, put forth a tax initiative, a 0.25% earned income tax increase, and this is an 8-year levy that has dedicated funding toward preschool. We get $4.3 million a year out of that levy. And it was a general levy in the sense that it also provided support to the city of Dayton for police and fire and streets and those kinds of things that take place in the city government. So it was really a unique situation where she put forth this along with her city commissioners, and it passed, and that allowed us to expand across the entire city of Dayton this year and then, of course, for the next 7 years. So I just put a summary at the bottom of that slide about our total budget so you have a feel for it, obviously much smaller than some of the other budgets that we've looked at given the size of our community and the fact that we have this earned income tax and then money from Montgomery County and the school district. And we have a little bit of money that continues to come in from private funders as well. We have primarily, I would say, we've used our private funders to help us pilot initiatives and to get things going. But in order to sustain ongoing operations, we have really felt like we need a reliable public funding source, which is why we've looked to Montgomery County and then the city government to help fund it. So that's my summary.
Thanks so much. I have some questions that I want to ask all of you before we get into questions from our listeners. We do have some of those. One of the questions is that part of this is understanding what revenue sources are possible at the jurisdiction level that you're working at, county, city, state. How did each of you, and I want to sort of go back to San Francisco and walk through, how did you decide that those were the funding streams to try to generate revenue from? How did you decide that the property tax was the thing to do, or that the soda tax? So start with San Francisco, September. How did that happen?
I think this is September in San Francisco. I think the San Francisco story is one we're a small and relatively education-focused community with a relatively small child population in a sea of a state that's had a history of sort of big governance, fiscal, and lack of education investment. So I believe our community felt like if we waited for the state, we'd lose generations of kids and families. And family flight's a big issue. We have the smallest percentage of families with young children of any city in the country. So we felt like we needed a local solution. And looking at taxation in California relative to other issues, our property taxes, because of something called Prop 13, were relatively low, and we felt, given San Francisco's sort of general demographics and political leanings, as well as lower tax rates in some cases, that our voters would stand behind a small property tax set aside. And that was a successful gamble 3 times now.
Mm-hmm. Makes sense. In Nebraska, I want you to talk about how you came to do this revenue generation through this education and land trust methodology. And people are very interested in how you got so many private sector funders to engage.
Well, sure. Going back to the education lands and funds, one of the principal objectives was to find or secure a source of public dollars for the corpus that would be politically palatable for the state, for legislators and voters as well. And one of the key selling points of going to educational lands and funds was that we are not actually abstracting those dollars from educational lands and funds. That money stays there. All that we're doing is earmarking the earnings of that money so that it flows into the cash fund. So that alone was a selling point from a legislative perspective, that we weren't actually removing those dollars. They were staying in place, intact, and it's just the earnings are being earmarked for a specific purpose. When it comes to gathering private sector support, I've alluded to the fact that we did have major philanthropy on our side. We also did a fairly aggressive public relations messaging campaign around the constitutional amendment that went statewide. So that helped make the case. But a lot of the same communications that we were designing and pointing at legislators also we discovered played well with the general public. So we were able to make the case effectively that this constitutes a sustainable and reasonable investment, not just for public dollars but also for private. And it's a lot of that was in fact geared or oriented towards private donors. But I think what we're really starting to do, or what we started to do back then in 2006, was set the stage for what we think is going to turn into a more substantial base of private investment that will one day include active business involvement as well.
Great, thanks. A question that let's go forward to Philadelphia, and Whoa, I have no idea what that is.
I think one of the speakers put us on hold, maybe.
Okay.
I'm sorry. My fault. My fault.
That was lovely music, but I want to ask the same question. It's okay. Philadelphia, like you came to the beverage distribution tax. What other ones did you consider? Did you consider ones? Does Philadelphia have an income tax? Donna, can you talk a little bit about that?
Yeah. So Philly has a wage tax and a property tax. Actually, we have 18 local taxes, major broad-based taxes. And we knew that there were going to be increases in property taxes for the schools, so that we would be crowding out the schools if we had gone in to try and find some property tax room. We also had recently increased the local cigarette tax for the schools and alcohol taxes. So that sort of had started a trend on these one-off kind of product-based taxes. And we, as part of the commission on the link that I shared in the slides, there is a schedule of other revenue sources that were considered. But truth be told, the reason we went with the sweetened beverage tax is because we really felt from the experience in San Francisco and in New York, even though the beverage tax had failed in New York, we really felt like there was enough lessons there that would teach us how to do it effectively, that we could, in coalition with the American Heart Association, with the medical community, with the early childhood community, with the millennial community that's more interested in natural beverages, that we just felt we could build a coalition to pass this. And so while other taxes were considered, there was a lot of momentum behind coming in on the sweetened beverage tax because it had failed under our previous mayor. And in fact, many members of City Council were smarting over the tactics that had been used by the soda companies and were a little interested in perhaps getting it passed so that they could show that they weren't happy with how they had been treated by the soda industry in that prior fight. In fact, our mayor had been against the soda tax when he was on City Council, and then saw the fact that they had completely misled the public about what would be covered, what would be generated, what the impact on business would be, and so he became one of the biggest proponents of putting it onto the soda companies. But I will say to your question, Anne, that these local powers are complicated. Philadelphia has powers that other cities in the state don't have, and we also have very strong constitutional controls on how we apply taxes with uniformity. And so, yes, for our pre-K work, we've had to become, whether it's at the state level or at the county level, tax experts so that we're able to figure out where there's room, where there's constitutionality that's available to us or constitutional provisions available to us, and where there's the political will.
Yeah, it's a complicated set of considerations and trade-offs, I think. I want Robin to, you did talk about putting the income tax increase in a package that included the Preschool Promise. It wasn't just the Preschool Promise, but did you consider other revenue sources in Dayton, in Montgomery County?
We did. We did look at the way it works in Ohio. You have a sales tax at a county level, so the county government would set the sales tax. The income tax is set at the city level, of course. So just considering our political environment, landscape, and the leadership's willingness to move something forward, it was really our City of Dayton leaders that were ready at the time to go ahead and put something forth. And so what they had within their power was the income tax. In Ohio, we use property tax to fund schools, so we did not look at property tax. That was something that we quickly took off the list for us, although my friends down in Cincinnati did use that with their similar Preschool Promise effort. And then we did a survey, a poll before, just to kind of weigh people's thoughts about this. But some of it too, as everyone knows, you look at what the other needs are in the community, and there were other needs within the City of Dayton government, so packaging it with the other felt needs in the community was kind of a win-win to put it forward.
Yeah, and a question that we also got was, how did the state of Ohio decide which cities to do this in? It didn't work that way. It was different localities in Ohio mounted different strategies, different revenue generation strategies, and to advance preschool and other things. And as Robin just said, in Cincinnati, it was a school bond issue, basically, that included pre-K along with others. Cleveland's done other things. Columbus supports preschool through its general city revenue. So there are different strategies, but it didn't come from the state. It emanated from the localities. One of the things I wanted all of you to talk about, and it's a question that, what was, some of you have talked about the role of public champions, the mayor, certain philanthropic leaders in the community, but how did you support them? How did you keep them going? And what kind of grassroots support did you have to mount to make these things happen? So I think it's a combination of both. And whoever wants to start can start, or I'll start calling on you.
This is September. I'll just say briefly for the San Francisco story, kids' issues have become really politically strong, but that wasn't the case in the beginning. And the beginning of our story was really actually grassroots activists from a local advocacy group and coalition called Coleman Advocates for Children and Youth, who really saw the need and the opportunity to better serve kids and families, and kids and families and youth themselves organized behind our first ballot measure. It's important to note we're a strong mayor government with an 11-member board of supervisors. And when our grassroots folks first organized in the late 80s with a children's budget, then moving into the idea of a property tax set-aside or children's fund, not one member of the 11-member Board of Supervisors would sign on. And so the grassroots coalition moved to a signature-based drive among San Francisco voters and walked into City Hall with stacks upon stacks upon stacks upon stacks of signatures from regular San Francisco people. And the measure then had the full support of all 11 members of our Board of Supervisors and the mayor before it actually was voted on. So it's a really important community coalition and grassroots story. It's become kind of new normal for politicians to support this, but it wasn't at the beginning at all.
So one of the lessons from that is it takes a long time to build this support up, but once you start building it, you keep it going, and it bears fruit. And I think the fact that you're going for a much longer, actually a permanent initiative this time is terrific.
Yeah.
All right.
Yeah.
What about in Nebraska? One of the questions people want to know is, how did you get the private sector to engage in this? And it sounds like it was that they felt that it was a good place to put their money. It was going to be in a permanent fund that was going to generate revenue from the fund. It wasn't going to be just all used up. And that was sort of a comfortable strategy for them. Is there more to it?
Yeah, I think that there's a lot to that. I think a lot of it had to do with the champions that we selected. We were very fortunate to have the Speaker of the Legislature be the champion for the legislation that created the endowment. And this person was a known fiscal conservative. We also had supporting that conversation in the legislature the input of the chief financial officer for the Gallup organization. They're headquartered here in Omaha. That person, his name's Jim Krieger, was a very visible and vocal proponent for the legislation that helped bring this about. So when you're talking about a major state employer, the focal point for fiscal conservatism in the legislature itself, those were two very powerful proponents and champions that we were able to bring on board at the time. Now, one of the most important factors is, that I like to remind people of is, we got to remember this was 2006. It's before the economic downturn. There was a lot of burgeoning interest in early childhood investment as an economic development strategy. Only 3 years beforehand, Rob Grunwald and Art Rolnick had published their analysis and study through the Minneapolis Fed on the return on investment. So there was almost this perfect storm of interest sort of in the environment at the time that helped us bring major business interests involved, or major business interest involved, as well as the leadership in the legislature. So we kind of had a lot of environmental factors going for us as well.
Makes sense. Anyone else have additional comments on how you support the champions and get the grassroots going? Because it does seem to take.
Well, this is Donna.
I was going to say it depends in part on the strategy you choose.
Yeah, and I just want to say one thing about this, and I'm assuming this is a routine in the other locations as well, is, every time our state and now our city has increased its investment in pre-K, we are very aggressive at getting, for instance, in Philadelphia, every member of city council, Republican and Democrat, and at the state legislature, Republican, Democrat. They are really the folks, even though I showed the pictures of the mayor, we spend a lot of time getting our elected officials into these centers where parents can thank them for the investment and get them to begin to use their campaign portals and their elected office portals to share with people in their districts that they are leading the charge on pre-K and creating videos with them, creating videos with the Republican caucus in our House and Senate in Harrisburg, but also here in Philly, so that the political discourses of Republicans and Democrats are owning, because this is a bipartisan issue. This is not a partisan issue, but enabling people to really own the agenda of investing and getting positive momentum about increasing that level of investment or the depth of quality or the going from 0 to 5 instead of just 3 to 5. And maybe that's a norm everywhere, but we spent a lot of infrastructure in our city and in our state making it possible for elected officials to be there, take credit, and hear from constituents. And our providers are key to making that happen, obviously, because we're going into their centers.
Yeah.
I imagine that's true in all the places. But the idea of getting public officials, elected officials, into the places where the funds are being used and seeing what good is being done is extremely important. Absolutely.
And ongoing.
And
ongoing, exactly.
So it's not a do you all have questions for each other among our presenters?
Somebody did, I think, ask Ann about how did we set in Philly the $8,500 rate. Do you want me to answer that?
Yeah, sure. The question is, how did Philadelphia come up with $8,500?
Yeah, so basically our state in 2013 or 2012 was spending $8,500 for a school day, school year slot. It's lower than the cost of care models that we're doing now would say is necessary, but because we were looking to integrate with our state system, we pegged to our state's rate. Now we are all collectively involved in trying to update the state's rate, and that will affect the city's rate, but the whole idea was that providers would have predictability and sort of a level playing field in payment. So that's the answer on that one.
Right, because that's basically saying we're going to, in Philadelphia, match what the state is putting into pre-K. We're going to say that's how we're going to spend that much too, so we can expand, right?
Mm-hmm.
And the strategy that's working in San Francisco is to build on top of and expand when funding from the state and the federal government is insufficient to support quality, you're adding local funds on top of those. You're not replacing them, and you're not just saying, oh, well, that's enough. If we want really high quality, we have to pay for it. So I think San Francisco's, the way in which you blend the amazing number of funds is incredible. And it's essential because that's how we're going to make this work.
Yeah, and I would just say I think there's pros and cons to every approach. We are really trying to, because we have such generous local support, we're really trying to kind of walk the walk and have a proof point of what's the cost of quality. And again, we're defining that right now at Tier 3 of our QRIS. We have an aspiration to tier it. But it is difficult, I will just say, part of the journey. We're only 8 months in. The good news is the rate environment, after being more than a decade flat in California, is changing. And our whole strategy is close the gap to Tier 3, which is wonderful. But the base is really dynamic right now, so having building our vision is requiring a level of nimbleness we didn't anticipate either in what the sort of the state and feds are offering in terms of eligibility or in terms of reimbursement rates. So that's stretching us to keep our model really fresh and dynamic, and stretching us to continue reaching for the right funding model, which I think is a good proof point we hope we'll have in a couple of years next time we have a webinar. But in the meantime, it means it's constant change right now.
What is that rate that you're paying to get to your Tier 3?
I know. Okay, so it's set. I'm scared to say this. I want to remind you that San Francisco is one of the highest cost cities in the country. I just want to tell you, the average 2-bedroom apartment is $2,800 a month right now. That's just housing. That's not food or anything else. So our Tier 3 rates are set by setting, age of child and setting. So the sticker shock number, just to tell you, full-time, full-year infants in a center are about $27,500 a year. Full-time, full-year toddler are about $21,000 a year. And then our full-time, full-year preschool rate, again, some of our programs are half-day, but full-time, full-year, which is what most of our families need, the city reimburses or closes a rate up to $17,100 per year per kid. So those are annualized costs. And honestly, those are based on paying professionals a bit more than Bureau of Labor Statistics, but nowhere near our North Star goal of parity on
with kindergarten.
With our kindergarten teachers. And our community-based preschool or infant toddler teachers, it's important to us that we pay the same, the whole 0 to 5 continuum, are earning about $20,000 a year less than a kindergarten teacher, and we estimate we need $55 million a year in new revenue to pay on parity. And that's part of this Chapter 5 kind of new measure that's pending for June would get us closer, a big nut closer to doing that.
So there's a question in the chat box. How did San Francisco arrive at those figures?
It was 2 years of study, and we engaged outside consultants to do a comprehensive fiscal analysis that really looked at local conditions and best practices, and helped us sort of develop the methodology that created the cost of care that we're keeping alive internally. So if you go to our website, sfoece.org, and go into policy and publications, you can see a link to our comprehensive fiscal analysis. And Mitchell, who's facilitating today, was one of 3 of our consultants who helped us with that process.
Thank you, because I think one of the things that San Francisco really did tackle was how to make sure that we're using every penny well, and we're not double paying, we're not leaving out certain areas or children or ages, or it was a comprehensive analysis.
And I would just say 2 notes, and we're only 8 months in. We have learned by integrating kind of our freestanding preschool for all program for 3 to 5-year-olds into one line of authority, 0 to 5. We learned we were locally funding a number of preschool spaces that were that could have been funded by state or federal sources, and the offset is several $millions this year. So that alone is showing us some efficiency from taking a more unified approach.
Yeah. There's a question, can you repeat that website? You don't have to repeat it. We'll make sure that it's in the materials that go out.
Let me see if I can do, I'll type it in.
Yeah, type it in the message box. Good. Wow. There are so many questions that we could ask about this. Are any of I want to ask our listeners, are any of you considering new revenue generation strategies, and what are you thinking about? And you want to put it out there and have some experts from across the country talk about, respond and discuss. If not, I'm going to suggest some of my own. I'm really waiting for the taxing marijuana. We've got a whole new area of possibility, and it's not something that's, one of the problems with taxing alcohol and tobacco and, things like that is that those are taxes on a behavior that you hope is going to decline. Same is true of drinking sugary sodas. But I'm going to say that marijuana, whether it's medical or recreational or both, is not likely to decline over time and is an excellent revenue source. And I want us to get in there and get some of that for children. So is anybody working on that?
Ann, this is Donna. Let me comment a couple things on that. I think you raised a really important question about declining revenue sources. And just in case anybody was planning to go the tobacco or the liquor or the soda, actually liquor has been an extraordinarily rising revenue source for our schools. We have a liquor by the drink tax that has outperformed any estimates that people all thought it would bring in, whereas soda is declining. However, I will say in our estimates on the yearly take, we estimated, the city was pretty good at estimating over a 5-year period about 30% reduction in the amount of tax that would be collected. So we factored that into our estimates. But I will say on the pot front, at least at the state level, and I'll just give you the Pennsylvania framework, is that there are lots of people who recognize that is a very viable new funding stream for lots of things, including treatment. Obviously, healthcare and substance abuse treatment would always have to be a leading edge on that so that the elected officials have cover on that. But it is also something that states are looking at to reduce reliance on property taxes writ large for their education component and or their schools, because the amount of money that comes in is so large. And so one of the things that we've talked about, because we always say pot for tots over here, because we actually did have a little campaign that was about slots for tots, which was casinos. And that happened, but it went for K-12, not pre-K, is how to build a coalition or a package for which new taxes imposed on marijuana would be dedicated for, that might be sort of the holistic package of investing in ways that reduce the school-to-prison pipeline. And that's one of the ways that things are being thought about over here, because there's, again, strong bipartisan commitment to want to do that, and obviously pre-K is a big part of that.
Yeah, and I think in some states there's discussion about supporting law enforcement, supporting various things.
Yeah, exactly. You'd have to do all those. It wouldn't be a dedicated, yeah.
Yeah, there's a concept in taxation about nexus, that what you tax and what you spend it for need to be related. I think federal gasoline tax pays for roads and things related to vehicles.
But that isn't about nexus. The federal gas tax it's just legislative. But I think nexus, by the way, for people, do not get caught up in that. Politicians conveniently use nexus when it matters to them.
Thank you. All right.
I do
when they want to block you.
Yeah.
This is September in California. The marijuana tax issue is alive and well. We have a pretty sophisticated 0 to 5 system of first fives in each county of our state funded on a tobacco tax, which is a hugely declining revenue source. And so marijuana is alive and well for a range of services, 0 to 5 health in addition to early learning. I would say I do see, and it'll be interesting to see how this next chapter, it's always a delicate balance of source and need. We're interested in the commercial gross receipts tax on our biggest employers because at this moment there's a strong case and evidence for the value of high quality early learning, what it does for the economic health of our city and our major employers, but we don't have a lot of participation yet in our system. So while we believe in the educational and child outcome lens, we also see the economic lens. So it'll be interesting. I would say our commercial gross receipts tax in June is aggressive, and business support is mixed at best right now. But some of the champions of our measure believe really strongly that they want to see business contributing to the early education components of our economy.
That makes perfect sense because business benefits from having a stable workforce that depends on high quality child care and early learning for employees now and for the future. So, I mean, it extends the ROI conversation quite a bit. But, yeah, makes sense to me. I don't know if there's a way to do this, but people in D.C. are saying we have a new locally funded grant underway to add 1,000 slots by 2020. Is that funded by something unusual, or is it part of the general revenue budget of the City of Washington? You'd have to type it in the box, I guess, because we have no audio for listeners. Well, I'll have to follow up on that. Right. Any other burning issues, questions you want to ask each other?
I had one question, and that was I noticed in September's presentation that you have nearly $2 million coming in from your foster care funds, and I wondered are they specifically for kids in foster care, or is it prevention dollars, or how's that working?
That's funny. That's all spending. So we do have a foster care child care program, and we provide foster parents access to high quality early learning as a support for serving our foster care kids. And we draw down about $1.4 million in federal 4E funding. We have a waiver in San Francisco that allows us to do some of that work. And then we use local dollars to extend that program. Basically, we can charge the federal government for quality child development or early learning while an active case is open. But if a family stabilizes and kids return home, the child care supports get cut off by our federal stream, and we actually think that's a perfect window to continue for the kids' learning and stability. So we use local dollars. So that money is local money. But I would encourage people to look at blending because there's a lot of opportunities to draw down about 50 cents on every dollar for child development or child care costs for in the federal universe.
Great, thank you. I'm being reminded that we have some polling questions that are evaluative that we'd like you to do. So I hope you see a poll on your screen with 4 choices. So make your choices and we'll see what the results are. And then there's one more question, or there's 3 polling questions, sorry. This is the first one. So do we have results yet?
Yeah, and we just want to give them another minute. They're still coming in.
Okay.
Oh, no. That closed the poll.
Whoops.
Let's move on to the second question. So you can go ahead and respond to the second question now. It should be up on your screen.
All right, this one's how lucky is it you will use at least one of these strategies or practices? while you're finishing your poll, I want to take this opportunity to thank our presenters, because this was a fabulously interesting and I hope helpful conversation. There's much to be learned from each other, and we ought to figure out ways to share and get together and discuss how these things work, because the contexts vary, of course, from state to state, but I don't know, high bar is getting a constitutional amendment passed in Nebraska, and really interesting to think about whether pot for tots would work and what we're competing against. So let's figure out how to stay together and keep communicating about these important ways to generate revenue for quality early care and education. I thank you very much. And we have a chat box that says, yes, thank you very much to all of the speakers. This was great information. You're getting rave reviews. So I'm going to turn it back over to Zelda if you have any closing remarks or reminders for people.
Thank you, Ann. No, I think we have our last poll up, and we thank everyone for joining the call today. And please tell us what was useful and how we can improve this webinar before logging off. So thank you.
And I see a couple questions. I see a couple questions about getting the PowerPoint and the webinar recording. So following this webinar, everyone who registered for the webinar will get an email with a link to those things, but it's also the link I've been putting into the chat box, and that has the PowerPoints, recordings, and other resources, including some web links for the entire series. So you can go check that out.
Great. Thank you so much. Thanks, everybody, and have a good rest of the day.
Thank you.
Thank you.
Thank you.